Welcome to Real Medicine, Real Lives. I'm Dr. Yassir Sonbol, and together we're showing medical expertise in a human way. Welcome back to Real Medicine, Real Lives. You love what you're watching? Don't miss a moment of Real Medicine, Real Lives or any of your favorite Now Media TV shows, live or on demand, anytime, anywhere. Download the free Now Media TV app on Roku or iOS and enjoy instant access to our full lineup of bilingual programming in both English and Spanish. Prefer to listen on the go? Catch the podcast version of the show on the Now Media TV website, www.nowmedia.tv. From business and breaking news to lifestyle, culture, and everything in between, Now Media TV is streaming 24/7, ready whenever you are. We're back right now with Dr. Alan Badeau, AI strategist, technologist, and CEO of Alan Badeau LLC. In the first segment, we looked at how AI and why it matters in medicine. Now let's talk about access. There's a lot of people that live in rural communities. They have to leave town or the state to get advanced care. But the truth is, today's technology is bringing high quality medicine to places it never reached before. So let's figure out and explore how this is happening. Dr. Badeau, welcome back.
All right, thank you. It's great to be here.
So, clearly that's something, I live in Sugar Land, Texas, which is technically a big suburb in Fort Bend County. I get people that come from an hour and a half away to see me. They feel like the care out here is better. They don't want to see their local cardiologist because they feel it's a small town. So how can, AI or cloud tools for small hospitals offer big city testing, for example?
Yeah, that's a huge problem. I went to school in West Virginia and went to West Virginia University, and that was a topic that I would hear just about every day. This small hospital is closed, and now a person has to drive 2 hours to go to WVU or some other major medical center to get treatment, and that's really hard on folks. And what it allows you to do though is if you've got those access to those resources, then you can almost borrow. I call it like borrow a brain is a good way to think about it, where you can have an MRI done in rural West Virginia, but then have either AI or that's trained on it or something else assess it, make some sort of diagnoses, at least to get things started, and then maybe a local doctor could have some sort of video chat using whatever the tools are that the hospital would approve to talk with specialists at bigger cities or other statewide facilities, and that really is the best treatment that they can get. One, they don't have to go very far. Two, they're still getting top-notch support from a variety of medical resources. And three, it's just it's faster, and faster treatment usually is a better it has a better end product to it.
Gotcha. And so, if some rural area wanted to find some way to help doctors, read scans in minutes, are there low-cost devices that you're aware of that use artificial intelligence to kind of make this happen?
There are some, there are, I know like portable ultrasounds that they have that allow, they're about the size of a smartphone almost, and I think they're like $1,700 or something like that. And for a hospital, that's not too bad for a cost. But they can connect to the cloud. They can take that data in, and then they can get a reading back from that, or an assessment of that. They've got digital stethoscopes. They've got Johns Hopkins just started an AI-based MRI capability, or MRI and X-ray capability, that you submit those into the cloud. The AI reads it, will give you a diagnosis, and it takes like minutes, as opposed to a little bit longer in some other cases. And it's those kind of things where high tech is starting to really impact that care. But it doesn't solve some of the other financial issues, because if there's no hospital there in the first place, there's no way to bring in those other technologies. So it's really a speed to deployment issue, because if they're they can get it, but there's nobody there to use it, it's not going to help.
And can you have any stories about, real success stories where remote technology may have saved a patient in a rural area that you've been involved in maybe developing?
Well, not so much that I've been developing, but that I've been following for sure. There was there's a tool called Telestroke, and it's a kind of a robot type tool, and it allows you to identify symptoms of early on stroke and really get treatment. And what is it? The golden hour, I believe, is what they try to say. And using this tool, they were able to identify it, get information down to Seattle, and then Seattle was able to examine him remotely. And then, they were able to send that information back to Alaska, and where a local nurse was able to give him, the clot busting medicine and some of those other treatments that really saved him. And he, my understanding is that he is fully recovered and has no permanent disabilities. And it's that kind of treatment, if you think about it, that is huge. That's really where you can have these breakthroughs. And I think AI, if it's used in those means, that's a great place to use it.
And so, you run into, we were talking about rural areas and et cetera. And so obviously in rural areas, so certain things like slow internet, difficult ways to communicate, things that may have blocked the progress or blocked the ability to use AI. So how do people fix those issues and overcome them in order to, be able to use AI in healthcare?
Yeah, that's been going on for years. Being like I said, I went to school in West Virginia, and the last miles just seemed to never be built. And broadband was always a challenge. It still is a challenge in rural West Virginia, and same thing with rural communities throughout the country. And these initiatives just they seem to get started and then stopped. But until we can fix those, and there was supposed to be funding for some of those, for whatever reason, it never gets spent. There's a laundry list of issues where poor internet now is the driving factor. It's not the doctors, it's not the technology. It is a fundamental lack of having good internet, and that's really sad. And unfortunately, we've got to fix it, but we've got to have some folks that are in certain government positions to really start to own it and stomp for it, because otherwise we'll be here 5 years from now and we'll have the same problem.
Yeah, no, I agree. I mean, I think, I laugh all the time when I'm in an elevator and my cell phone reception drops, and I say, we can talk to a man in space, but
Yep,
we can't seem to get a cell phone reception inside an elevator or in a
that's
big.
right.
And it makes absolutely no sense to me. Like I just don't get it. Why the technology somewhere is really robust, and the technology where everybody's living and using it just can't seem to get it together. I
Yeah,
don't agree.
it's unfortunate. It's unfortunate. Even cell phone signals and stuff, they try to do that, and it's still, like you said, it still drops. It's still slow. It is really sad that you're right. You can't maintain your signal in an elevator.
So how does technology, for example, help people, loved ones stay closer to home during treatments they may undergo? I mean, what
Well,
experience have you had with that and been part of, implementing or et cetera?
yeah. Yeah, the telemedicine stuff. I mean, COVID really drove that. The people didn't stop getting sick, right? They still had COVID, but they still had all these other things that had to still be treated. And I think for the first time, it was a little wonky to begin with, but bandwidth was an issue, and what kind of software you're going to use, how you're going to transmit data, all that stuff, approvals. That's the first time, though, we didn't have a choice. We had to use something in order to try to, maintain your health, or maintain, an ability to support folks that get other types of, diseases and stuff. And, that really tested a lot of different technologies that folks weren't expecting. And those solutions now are getting better. They're getting faster. They're getting AI support now, and that's great. But I'm a little concerned though too that maybe it's becoming a little too impersonal sometimes. You're just going through the motions, either the patient or the doctor. So we've just got to really make sure we have balance between those.
Yeah, no, I agree. I mean, we, during COVID, I remember offering telemedicine. Interestingly enough, Nobody wanted to do telemedicine to come to my office. They all wanted to actually come in. It
They
was
wanted to get out.
They wanted to get out. You're right. You're absolutely right. Although I mean, COVID was a really, really tough time. It was sad to see, some of the people that had to say goodbye to their family members over an
Mhm.
iPad. And I mean, it was great that we had the technology to be able to do that, but it was also very, very sad at that time that, those are the kind of things that happen.
Yeah.
Mm. So yeah, I mean, I think artificial intelligence has really come a long way, obviously, since the development of it, and I think it's going to continue to progress in healthcare.
Right. Yep.
Uh, I'm actually just personally looking into these AI services that offer, transcription services because I'm tired of dictating all my own notes all the time. So,
Hmm.
so yeah, I think this is really, really interesting information. Um, so one of the things I might want to ask you last is, if somebody wants to learn how to have their local clinic benefit from technology, what would be the first step for them to do?
Well, I would say I'm more than happy to help people for free. If they have an issue and they want to learn something about AI and how they can use it or any kind of technology, reach out to me because I love doing that kind of stuff. It's important for me to give back, and any way I can help them in that manner is great. I would also say though, make sure that they contact their local hospital system or somebody like that where they can get an idea on what sort of things they're doing and how they can help them so it stays local.
Great. Well, Dr. Badeau, thank you so much for this insight. We're going to take a quick commercial and we're going to come back and discuss more artificial intelligence with you in healthcare and how we can see how it can improve our lives. Hang on, everybody. We'll be right back.
Stick with us. We'll be right back with more real stories, real breakthroughs, and real lives transformed.